Hi, my name is Sean Day, and I'm the president of Med Billing and Consulting Group. We are a practice management company, and we help healthcare providers increase the value of their practice by hundreds of thousands of dollars each year. We focus on top line revenue growth while driving down those costs and saving our clients an average of 15 to 30%. We're a consulting company that puts contingency plans together to help our clients in the healthcare industry move very quickly to capitalize on opportunities in the marketplace. And today, there's just a huge opportunity with the CARES Act signed into law. My team and I are going to talk about the turnkey telemedicine system we've put together. It's incredible. It's by far the easiest way for nurses, APRNs, physicians, and other healthcare providers to increase their revenue by $10,000, $20,000, $50,000 a month or more with no upfront cost. Let's get into it. Let me show you our turnkey telemedicine system right now. So let me talk a little bit more about who we are. Who is Med Billing and Consulting Group? Well, my name's Sean Day, and I'm the president of the company, and I'm also an entrepreneur. I've been involved in the creating or developing and selling and buying of several companies over my 30-year span as being an entrepreneur. And we've got physicians, other medical professionals, we've got people that are practice managers, we've got somebody on the board of a hospital, healthcare insiders, health insurance insiders, coders, billers, and many more professionals to take very good care of you with all the practice management consulting that we do. Now, effective for services starting March 6, 2020, there's been a great deal of change in regulations to help with the COVID-19 public health emergency that's going on. And this will last, these changes, until the end of the COVID-19 public health emergency, which will be determined in the future. A couple of the key takeaways here are the duration of the COVID-19 public health emergency. Medicaid will make payments for Medicare telehealth services furnished to patients in broader circumstances. These visits are considered the same as in-person visits. Okay, so starting March 6, 2020, and for the duration of the COVID-19 public health emergency, Medicare will make payment for professional services furnished to beneficiaries in all areas of the country in all settings. Medicare will make payments for Medicare telehealth services furnished to beneficiaries in any healthcare facility and in their home. The Medicare coinsurance and deductible would generally apply to these services. However, the HH Office of Inspector General is providing flexibility for healthcare providers to reduce or waive cost sharing for telehealth services. So that's waiving, deductibles and co-payments. And to the extent of the 1135 waiver requirements, an established relationship. So in the past, you have to have an established relationship. The HHS will not conduct audits to ensure that such a prior relationship exists. So you can take on new clients with this as well now. The distance site practitioners who can furnish and get payment for covered telehealth services subject to state laws can include physicians, nurse practitioners, physician assistants, nurse midwives, certified nurse anesthesists, clinical health workers, and registered nurses, APNRs, nutrition professionals, and others. I do want to make this clear that the information included in this brochure or video is not considered to be any legal advice whatsoever. Please consult with your attorney or legal advisors. The information from the CARES Act is coming so quickly, and it often changes and interpretations change. You'll want to check with your private payers and Medicaid plans to understand each of their changes and policies. And that's one of the things that we do for our clients is as a consulting group, as a medical billing and consulting practice consulting management group, is to put together contingency plans. There's something that's happening out in the market right now with the CARES Act. So you've got telemedicine, CARES Act opportunity, the opportunity to screen for symptoms of COVID-19, flu, cold, depression, via telemedicine. Let me talk a little bit about the telemedicine platform features that we have included in our turnkey system. The quality of video is outstanding. There's no downloads. You don't need to buy software. It's very easy to use. It's got a waiting room, just as though it's an inpatient or an in-office patient visit. You've got a waiting room. You've got meeting history. It's very mobile friendly. You can do it from wherever. Clemson had a review on several different telemedicine platforms. This one was ranked #1 as far as ease and ranked extremely high overall. Again, it's got a patient queue. So you're very busy as a provider, and sometimes you're running a little bit late. The patient queue allows you to see who's waiting. Patient check-in module as part of the telemedicine platform. There's a lot of things that are telemedicine platform features. It's one of the best on the marketplace today. Patients love it, and it's loved by over 500,000 providers from 136 different countries. All medical professionals agree that testing as many people as possible for COVID-19 is one of the most critical parts in fighting against this pandemic in this country. What better way to do it than our turnkey telemedicine system? Telemedicine is the most time-efficient method to screen and diagnose symptoms of COVID-19. Diagnosing as many people as possible will help get those with the symptoms tested as soon as possible. I'd like to talk a little bit about telemedicine and depression screening. Our turnkey telemedicine system is ideal to help screen for those that may be going through some very difficult times during this pandemic. If you went to Google the words depression during COVID-19, there'd be over 500 million results that would come back. So there's no doubt that many people are experiencing stress, anxiety, and depression during this crisis. After all, millions have lost their job. There's all kinds of financial issues and uncertainty out there, lockdowns, and etc. So telemedicine is probably the most time-efficient method to screen and diagnose symptoms of depression and anxiety and related issues. According to the United States Preventative Task Force, many practices are choosing to do a two-step screening process using the PHQ-2 and PHQ-9 test for depression-related symptoms. So let's talk about our appointment setting services with the turnkey telemedicine system. Our goal is to provide you with appointment setting services for your new patient opportunities. Also, we can help reach out to your current and established patient list. We also want to reach out to thousands of Americans to find those that feel they may need your services via telemedicine. So we are simply acting as a conduit to allow Americans in your area to know telemedicine is an option for them. We will match your capacity to perform as many telemedicine appointments as you're able. There's been some important changes post-CARES Act, and you are now allowed to acquire new patients, and not just for COVID-19 testing, but for other assessing and testing and screening as well. We are a professional practice management and medical billing company, and we're dedicated to meeting all of the insurance and patient billing needs for you. So you don't even have to worry about the medical billing part of it. So our medical billing services, we process primary, secondary, and tertiary insurance claims. Then we follow up with the primary and secondary insurance. We post payments to insurance and patient accounts. We track unpaid claims and send letters of medical necessity when needed. We provide notification of any incomplete claims. We help resolve issues to get you paid, and we get you paid faster than anybody else out there. We follow up with patient payments and generate patient statements and mail them out. We have outstanding financial reporting that we provide to you on a weekly, monthly, and annual basis. We're doing all the back end stuff and getting you paid for your healthcare services as quickly as possible.